Hello, I am Dr. Laura Lewandowski, and I'm a physician scientist at the National Institutes of Health. I study the genetics of lupus in diverse populations worldwide. For my WomenLift project, I really wanted to understand more about the leaky pipeline for women in leadership in academic medicine. Women make up 50% of all medical school classes, but when you look at leadership positions, they hold only about 18 to 25% deans and chairs. And so I wanted to understand more about what goes into decisions behind women choosing leadership in academic medicine. The first part of this project was looking at a financial analysis of this using NIAMS data. So we know that medical education debt in the US is large and is growing over time. In 2018, the median debt was $200,000 US. We also know that there's a gender wage gap, so women get paid about 75 to 80% on the dollar, and that is true across all subspecialties in all areas of the country. And there's also a gender wage gap. So starting when women graduate residency, there's a wage gap, and that gap grows over time as they advance through leadership. So I wanted to understand, given medical school debt and this gender wage gap, what's the actual financial return on investment for women when they choose leadership? So for this return on investment analysis, I kind of wanted to do it in a couple different ways. First, just overall look at the general differences between men and women for return on investment when they choose leadership positions. Then I wanted to explore it for different subspecialties. And then finally look at women with intersectional identities. So the return on investment for Black women, for Hispanic women. And so that is the current analysis plan. My research team, I'm being mentored by Dr. Julie Silver and Allison Larson. These are two women with an extensive experience in gender equity research and women's leadership. And they helped me to develop the research idea and refine my research questions. And then I have Daniel Brightwith and Lauren O, two MD PhD students at UNC, who are doing the actual return on investment analysis. And we're using NIAMS data. We're actually waiting for one more additional data set that's not public for the NIAMS to release it so we can complete our data analysis and hopefully moving that forward into publication shortly. However, as I was going through this project, I realized that there are more than financial imperatives for women to choose leadership. So I wanted to really understand other factors which influence these decisions. So I created a semi-structured interview to explore barriers and facilitators of choosing leadership for women in academia. I administer these interviews to a diverse cohort of women of all different academic ranks throughout the United States. And I found a few different themes emerged. So these women continue to face bias in academic medicine. So there was a woman who was at the same level as her male co-fellow. They both had Ks. There was an increase for clinical demand, and they were both asked to do more clinical time. And they said, we can't, it violates the terms of our K. And the male co-fellow had his time continue to remain protected, while the female co-fellow had to do additional clinical time. Women still aren't always perceived as leaders in their field. So one time a woman was interviewing for a leadership position, and one of the committee members said, how are you going to convince an old guy like me to listen to you? There is a family penalty where men are seen in a more positive light if they have a family, and women are seen as more negative light. So they may be perceived as being not as committed. Yet even when they come to work and show up and put in a lot of time, people might ask them things like, why did you have kids if you didn't want to raise them? So it's a double bind. There's women who told they were just deterred from pursuing their goals. One person said, I just was told I shouldn't try because I might fail. And I said, people fail at things every day. I want the chance to go for this. And then there's a compensation bias. So women are more often asked to do unpaid work. And when they are asking about their compensation, they're often told they're going to get compensated less because they are not perceived as the primary breadwinner. So this one was told, oh, your husband is a physician. You don't need this money. And so I'm going to continue to summarize those themes and move this work forward. And I hope that both the financial analysis and the qualitative work will inform institutions on ways to maximize their facilitators and minimize their barriers, and hopefully get us to a more equitable leadership in academic medicine. And with that, I would like to say a huge thank you to my NIH mentors who've been such great support for this WomenLift Fellowship, and also all of the WomenLift staff team and my co-fellows for making this such an amazing experience. Thank you.